Hey, lovelies. Thank you for coming here. If this is your first time, please subscribe so that you get notifications whenever we upload a new video. If you are a returning subscriber, thank you very much and keep watching. Um, this is your girl Sarah, and we are still discussing the new talk of Midwifery OSCEs. So we are now going to look at we are going to start with the marking criteria for the planning, labor and birth EPI. Then we are going to look at how to, and you also have to take note of the things that you need to do during the planning, labor and EPI, during the labor EPI. Okay, please keep in note that this is a silent station, so it also takes 14 minutes. You don't speak to the examiner. So let's start with planning, marking criteria. I'll show you here. This is the marking criteria that I'm going to read for you one by one. Okay, just as you see, this is the midwifery marking criteria as of January 2024. Okay, so what we have, so one, we have assesses the current situation, identifying main issues including progress of labor between assessments. Okay, assesses relevant history including medical and obstetric history, medication and allergies. Remember to ask the mother if she's currently taking any medication, and to ask the mother if she has any allergies. The allergies, you ask her if she asks any allergies she knows, and if she takes that medication or that causes her allergies, or if she takes that thing that gives her allergies, what does she get? She may tell you she gets rash, she gets running stomach, anything that it does to her. Okay, so number 3, we say it logically and accurately documents the details of the intrapartum assessment. And then number 4A provides recommendations according to NICE guidelines, intrapartum care guidelines. Please, for revision, please go and see the NICE. They call them NICE. I call them NICE. Others call them NIC. I call them NICE guidelines. Okay, the NICE. So the NICE guidelines, these are approved research-based guidelines that should be followed by every practicing professional in the nursing and midwifery. So we have considers options to promote normal physiological processes and comfort of the woman. That's for B. Then for C, we have continues with appropriate frequency of maternal and fetal observations according to the NICE intrapartum care guidelines. So you see how it keeps repeating itself, so please go and have a look through them and comment with what you've got. Comment with the answers you've got, and then we shall see. I can be able to reply back your comment. And then we see logically and accurately documents the details of the recommendations, recognizes the need to involve the woman in the care planning process, recommends appropriate time frame for medical review, ensures that midwifery recommendations are current or evidence-based on best practice in line with culture, National Institute of Health and Care Health and Care Excellence Guidelines, uses appropriate professional terminology in care planning, writes clearly and legibly, accurately prints, signs and dates when required, acts professionally throughout the procedure in accordance with the NMC 2018, the Code Professional Standards of Practice for Nurses and Midwives and Nursing Associates. Okay, so basically those are the 10 marking criteria. So we're going to go on and read and see how what to do, what to do, what to do. So how is how you go through them to make sure that everything is covered, okay? So we're going to look at the situation. Remember we say that we use SBAR. It's the tool that we use when writing the planning. This is the silent station, remember? So we use the SBAR. SBAR is like the S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. So our situation, you introduce yourself, like my name is Sarah, or Sarah Nachtende, or Sarah Nanahu, or Bidenwad, or Ami, or whatever your name is, okay? Introduce yourself and your position, your role. So introduce yourself, the name and the role. I'm the midwife, okay? After introducing your name, then we go on to talk to the patient to introduce their name, date of birth, hospital number, and any allergies. So my patient is Nasuna Jamira, date of birth is 12 January 1994. Her hospital number is 1224 6 up to 6. Who presented with lower abdominal pain or with lower abdominal pain and vaginal discharge? You write what the patient came with. Those are the presenting complaint. So that's what you write. Patient presented with this. Then we shall go on to look at the background. When did the presenting complaint begin? What time? How long have they lasted? Were they severe? You have to also note the intensity. Then you also note the additional history, which is on the scenario paper. Remember to check the family, medical, social history that is relevant for the condition the mother is in, okay? Then we shall go on to do our assessment, where we shall be required to fill in the pathograph. I think I showed you how the pathograph looks like. So this is our pathograph. It has the fetal heart rate, it has the fetal heart rate, it has the cervical dilatation, it has the set of the membranes, it has descent, it has contractions. So don't forget to write your candidate name here. This is the mother's name, the gravida, the parity, this is the hospital number, this is the blood group, okay? Then you see the time of admission. Then you go on. Remember, I think we shall have to do a video of this so it's more clear. I'm still learning how to edit. How to bring closer. Okay. Yeah, I think you see this, whereby we document the blood pressure, drugs given, IV fluids, and the urine. Remember, okay. So after the background, after the pathograph, we are going to look at the furthermore, let's explain still about the current assessment. Let's say the mother came at 10 a.m. You did the maternal observations. I've shown you where to document the maternal observations. Remember, we have 6: temperature, pulse, blood pressure, respirations, capillary refill, and the oxygen saturation. Those are the 6. Make sure you have them in your mind. Then we have the abdominal palpation. If we look back, we did everything that you're supposed to do on the abdominal palpation. We observe and then go on to palpate, okay? To feel for the presentation, the lie, descent, fetal movements, and also still remember to ask the mother about before you ask the mother, we're looking at the presentation, we're looking at the engagement, we're looking at the lie, we are looking at the fetal heart rate, we are looking at the contractions, we are looking at the strength of the contractions, then we are looking at the fetal movements. When you reach at the fetal movements, when you ask the mother, does she have fetal movements? Is she happy with the fetal movements? Okay, you need to confirm that with the mother. Also, something to note is that we do not measure symphysiofundal height in labor. Take note. Then we go on to do the vaginal examination, where we're looking at inspecting the perineum. Is it oedematous? Do you see any signs of genital mutilation? I think when I talk about genital mutilation, you all know what it is, whereby sometimes they cut off the labia, or they cut off the clitoris of the female organs. Then we look at the temperature, the warmth of the vagina, and that you also note the station of the presenting part. You note for the cervix, you note the dilatation, the position, the consistency of the cervix. What else? Then for the membranes, you note are the membranes intact or ruptured. Then you go on to note the color of the meconium, color of the membranes. Are they clear? Are they green? Are they red? Then you go on to note. Yeah, so we're still looking at you also look at the caput. When you palpate the head, the presenting part, do you feel the caput? Is there a caput? Is there molding? You also fit for the position of the fetal head. Do you feel the anterior and the posterior fontanelles? Then you also remember to ask still again about the pain score at the rate of 0 to 3. Okay. Then note the differential diagnosis. From the assessment, you may have something like malposition or slow contractions, slow labor. Then we go on to the recommendations. So with recommendations in the labor scenario, definitely we shall look at the midwifery assurance. Oh, sorry. We're going to look at one-to-one care in labor. We're going to look at CTG monitoring for meconium and advanced maternal age. We are looking at fetal heart rate, recording every 15 minutes for the first stage. We are going to look at contractions, recording every 30 minutes. And then we're going to look at maternal pulse every hour. Okay. You should also ensure to empty the bladder, because this woman is in labor. We all know what a full bladder does. Then we also ensure for the mother to be hydrated. If she cannot be able to take orally, make sure you give the IVs, like Ringer's lactate or normal saline. Then you should encourage mobilization for the mother to move around the ward. We also talk about informing the doctor to prescribe antiemetics and pain relief. Okay. The antiemetics will help the mother in case she's vomiting, so it should be according to her condition. Is she vomiting? Then we also talk about active management of that stage of labor. We talk about 4-hourly meals chat. We talk about midwifery support and reassurance. Then we talk about you escalate if you have any concerns. Then we talk about preparation of resuscitation equipment and neonatologist due to meconium. Okay, so then we shall go on to see if So also what you'd like to add could be if the mother came with if you had a scenario where the mother came with abdominal pain, you could also look at reviewing the mother, obstetric review by the obstetrician, so that they can do a speculum examination, taking off the midstream urine sample. Then we also look at prescription of analgesia for pain, and then we also look at the midwifery support and reassurance that is needed for every scenario, because every mother needs to be reassured, you know. And then we look at to ensure the mother is hydrated. We also look to ensure that we educate on the signs of labor, signs of true labor. I think that's it mostly about the planning. I don't know if we have anything else. I think basically that's it about the labor planning. And so we're now going to go on to the postnatal planning so that we finish up these stations. Yes, I would still continue to tell you to comment in the comment section if you have any questions, and if you need clarity on something, feel free to leave a comment, and then please subscribe. Thank you for watching. I appreciate your effort and I appreciate your support. Please share to someone who may need this video, or recommend it to your friends, please. Let's share the information worldwide. Thank you so much.